Please don't forget to subscribe. Let's begin. Number 1. We received a call about a 23-year-old lady who had been shot in the head when we were on an ER rotation in medical school. She was already dead, but it turned out she was 5 months pregnant, so we performed CPR on her until we could get her to the hospital to see if the baby was viable. C-section was performed in less than a minute and the baby was delivered safely and quickly to the mother. Although it's not unheard of, seeing a kid born from a deceased person with their brain exposed was a little unnerving for me because she was around the same age as I was at the time. Number 2. Here's an ER nurse. I was performing cardiopulmonary resuscitation, CPR, on a woman whose heart had stopped. It took them a long time to bring her inside the room because she was still asleep. This woman appears to have died. It was only when she was doing chest compressions that her hands reached up and clung to my wrists. We never heard from her again. Number 3. At the time, I worked as an EMT in Montana, where I witnessed an incident similar to the one I just described. It's been a day to remember. A few weeks after the occurrence, the young man was set to marry the daughter of the sawyer who had cut down the tree. Adding insult to injury, the young man's life could have been saved if the surgeon hadn't been a haughty jerk and refused to come in that day. Very small town. He reached out to me 1.5 hours into treatment. I was bagging him, and everyone's faces were utterly relieved when the monitors showed that he was still flatlining. To this day, I still resent that surgeon for deciding that child's destiny after we all spent hours pumping fluids and blood into him in the vain hope he would survive. Over the phone, the doctor decided that his life was worth less than it actually was. Even while I miss being able to aid others, I never miss the feeling of powerlessness and defeat that comes with fighting these conflicts. Number 4. In the event that a code is called, you must always ask about a patient's DNR status before admitting them. When I worked as a therapist, I had a patient in her late 80s or early 90s who was both extremely demented and chronically unwell, in and out of the hospital every month barely holding on to life. Basically a horrible, miserable quality of life. DNR status is important because you don't want to put someone through a terrible resuscitation that may fail if they don't want to die naturally. I inquired about this with a relative who had medical POA, but I can't remember for sure because it was quite some time ago. That's what she said, plain and simple. Oh, we want everything to be done for him because we really need his check. The family was obviously surviving off his Social Security and couldn't give a damn about his suffering or wishes, which confused me at first. I'm quite sure it was the spookiest thing I've ever witnessed. He was being treated like an inanimate object by people who were supposed to be his family members and who were supposed to be taking care of him. Number 5. My relative worked in a cancer treatment facility. Acquaintance was diagnosed and accepted as a patient by the doctors. The trashiest of rubbish was where this girl came from. In the living room of the trailer where they were living with their ailing grandfather who was on a ventilator, there were 6 or 7 of them. He was also being kept on for the sake of the check. The mother refused to allow her daughter to receive anything more than the most basic of care. As an adult, she was weakened and unwell after receiving a few radiation treatments. She said that her daughter needed to stay home and care for her mother's new baby. In fact, she gave up her oldest kid to care for her younger one because she couldn't be expected to do it all. After the death of their daughter, I was able to see the family a few times. Her death was treated with such callousness, as I recall. It was all about the bills and the loss of welfare because they were down to just 5 people in the family. The mere act of recalling this evoked the following recollections of her. When she was alive, the daughter struggled with her own problems. When we first met, she was about 15 years old and I was in my early 20s. She tried to have sex with me in a restroom by locking me in. I was reminded of another instance when a mother cornered a friend in the same manner. I'm convinced that they were attempting to raise children for the sake of welfare. Number 6. I'm a medical on-call night owl. For those who don't know, I'm a nervous wreck. I'm back on the ward where I started my shift about 3 a.m. to observe how an ill patient from the beginning of my shift is progressing. They tell me he's a lot better and the most recent obs are much better, but that his chart is at the other end of the bed when I talk to the nurses at the desk. I'm on my way to the patient's bedside in no time. The curtains are pulled back, and I use my flashlight to check his records without disturbing the other sleeping patients. All is well and I'm satisfied. Suddenly, in the darkness, I'm tussling with a slumped-over old man, who appears to have sneaked up on me silently. My own heart is racing simply thinking about it. I fly backwards, scream, and trip over a drip stand in the process. As he begins to scream, the nurses sprint over, one of them pushing the crash cart. At night Albert likes to go for a walk. Oh doctor, that is just Albert, he enjoys it. Number 7. Here's a former ER and critical care nurse. In the mid-1980s, 2 incidents occurred at a prominent Houston hospital. Medical professionals often accuse me of lying when I tell them what I really think. I'm not at all. Both come from the emergency department. A 25-year-old man is brought in by the EMS. With his hands outstretched and his head tilted, he appears to be decerebrate and is currently being handbagged. There were no tubes attached to his mouth or nose when he walked in the door. He was either inebriated or unconscious when his girlfriend found him in bed with another woman, according to the emergency medical services. She had a .25 caliber pistol with her, and according to the report, she pumped 10 shots into the patient's head from various angles with the weapon directly on his skull. After bouncing around for a while, they were able to enter the skull but not depart. Autonomic functions persisted despite the loss of all higher brain processes. One of the old Bourne's bare ventilators, crude by today's standards, was used to intubate him. He bucked the ventilator with deep coughs, as a result of this reaction. Pressure in his head/cranium, ICP, increased and small fountains of brain matter would be ejected from the 10 holes in his skull, many feet, when he performed this. I was hit in the face by one. Clinical distance insulated me at the moment, but I must admit that this truly impacted me. He died a few weeks later of a huge infection because there was nothing more that could be done for him. As part of an extreme sexual ritual, another young man had agreed to be mummified. Even his face was covered in a plaster cast and he was given breathing tubes inserted into the cast. Except for his toes and genital/anal area, he was completely encased in the cast. According to my understanding, it was deemed attractive to experience this level of helplessness. To compel ejaculation, it was common to insert a cattle prod or similar object into the rectus abdominis. Nonetheless, he was attached to 220 volts with one probe in his rectum and another on his foot, either through ignorance or malice. When he smelled it, it was clear to him that his entire genital and perianal area was covered with third-degree burns. It appeared like his rectum was bleeding blood, feces, and other bodily fluids. By the time we were able to remove the cast, it was evident he was already dead. We tried to resuscitate him by removing the cast. In the silence, we were absolutely unable to express ourselves. Nobody could speak when the police arrived. When I saw the situation, I volunteered to remove the cast and provide some post-mortem care. I discovered extensive scalds and burns on nearly every inch of his body. We took the body to the medical examiner, and I spent the rest of the shift shivering and vomiting because of my fear and anxiety. It's all right. Now everyone can label me a liar. But the truth is, I told both events exactly as they occurred. Number 8. The year I spent working in a psychiatric intensive care unit was an experience I will never forget. When I reflect back on it, creepy isn't the word that springs to mind, but heartbreaking and terrible. But there was a creepiness to it. Especially night and early morning shifts, of course. In the presence of someone who is hallucinating, there is always an unsettling sensation. On some level, you can tell it's real to them, and that helps you believe it. The phrase "and of course, I had to check my back to be sure" is a common one in many stories. You can observe the range of feelings it elicits. Here are a couple of tales to whet your appetite. A woman sat across the table from me during her interview for admission. Her arms were covered in bandages, and her lips and ears were taped shut. She didn't sit still and looked uncomfortable. When the nurse asked her a question, she would answer quickly by peeling back the tape on the corner of her mouth. The bugs were crawling all over her and were attempting to get inside of her at the same time. Using the tape, the bugs could not get through. To get rid of the bugs, she needed to apply bandages. Even as we sat and talked, she couldn't sit still because she could feel the bugs crawling all over her. Even worse, She had a vague suspicion that her imagination had twisted things. What if you went through your life feeling like someone was throwing buckets of cockroaches on your head all the time, all the while knowing cognitively that none of it is real? When I arrived at work, I found a girl fist fighting the same ghost for an entire 8-hour shift. A few punches later, she'd fall to the ground and twist her hand around like she was winding some long hair around her wrist. She had clearly scored several knockout blows. Her opponent would be dragged down the hallway, kicked a few times, and then set up for a curb stomp by her. When you consider the vivid images going through her head, it becomes scary. After watching this replay for hours on end, it becomes depressing. Number 9. A good friend of mine used to tell tales from her early days as a nurse. According to protocol, she was performing an examination on a patient. To treat a lung infection, he had went to the doctor several times and been prescribed an antibiotic each time. A nurse and a doctor had already visited him, and she was the last point of contact before he was discharged. It's a mystery to me. If you ever need a shirt, you can find one in my hole. Apparently, this guy had an enormous abscess and forgot about it until it was too late. At the time, it was so big that he could fit 3 shirts inside of it. Not telling the doctor or getting it looked out was a mistake. By the time the final one was removed, the stench was so strong that it vacated the entire room. Number 10. Despite the fact that I'm not a doctor, I work as a dental hygienist in the healthcare industry. In my opinion, this is the creepiest or most puzzling thing I've ever come across. They came in for their first dental appointment. A child of about 3 or 4, his mother said that he had never been to the dentist. I didn't give it much thought at first because it was so typical of what I see on a daily basis. Afterwards, I took his x-rays and completed his cleaning. At this point, things really went south. I was able to tell from the x-rays that the child had already had extensive dental work completed. He'd had perhaps 6 or 7 composite, tooth-colored, fillings. Once again, while I sat in my chair, I probed the parents about their son's dental history. In addition to insisting that he hadn't, they maintained a relative couldn't possibly have taken the without their knowledge. What's going on? What caused this? Who kidnapped him and took him away? What had become of the children? Had they been in jail for a long time and not realized he'd been to the dentist and had treatment done on his teeth by someone else? What if it wasn't their own child at all, but rather a fugitive they'd snatched? Insurers were unable to find any earlier records of dental work, so this was a dead end as well. I ponder it frequently, yet I'm aware that I'll never learn the solution. It's a pain. Holy crap, this thing exploded. Even if someone did read it, I didn't expect them to find it creepy. The truth is, I wish I had more answers for you, but I don't have any. I'm very sure the family never returned for his regular cleanings, as far as I know. I can only pray that the child is safe and well cared for, no matter what the circumstances may be.